Hello, I'm Dr. Peter Lewis and I'm recording this video to help people who are currently infected with COVID. And having been through the experience of COVID myself, I have a bit of empathy for you and want to offer you all the support that's available through our clinic. Because we are so incredibly busy at the moment, I'm making this video to try to save time during the consult. So what I'm going to do is essentially cover all the things that I'd like to talk to you about. And my apologies if you've had troubles getting an appointment with me, but if you or your friends say that you have active COVID, I'm trying to make the commitment that we'll see everyone within 24 hours of making a call. And regards this, we're trying to keep those calls short with this information. So the first thing is what we're trying to do is to prevent long-term consequences of COVID. And the earlier that we institute some treatment, the more we can avoid the two major long-term complications of COVID, which are blood clots and chronic inflammation in the lungs. So with that in mind, what we're trying to do now is reduce inflammation and reduce your chance of clotting. And the first thing we want you to do is to drink lots of water. We also want you to take a 100 milligram aspirin tablet every day. The next thing we want you to do is to make sure your nutritional status is excellent. And that means we want you to be taking some supplements, which you should be able to get from your local chemist. And they include vitamin B, vitamin C, zinc, Q10 and quercetin. Probably the most important supplement you can take is vitamin D. And the sort of doses that we're looking for in vitamin D are way in excess of what you'll normally be getting from your local GP or pharmacist. They will generally have the 1000 IU in stock. Some pharmacies will stock a 7000 IU, but we want you to be taking up to 50,000 IUs in the first few days. Some hospitals overseas are actually giving 600,000 IUs as a standard dose to everyone who's admitted with COVID. The next thing I want is for you to get a pulse oximeter meter, which is a thing that goes on your finger that I carry around with me all the time, and it looks like this. And that will give you your oxygen sat meter readings. Now, some hospitals and DHS contacts are providing these for free to patients, but some people are having troubles getting the support and actually getting contact from anybody. And if you are short of breath, this is the machine that will help us decide if you need to go into hospital or not. If you have troubles getting hold of an oxygen saturation meter, we have some available from our reception desk for a price of about $60. Essentially, if your O2 sat is above 90, you're probably well managed at home. If it drops below 90, then please contact us immediately or an ambulance, because it's when your O2 sat drops below 90 that you start to get into dangerous territory and you need oxygen from a hospital. Now, we're going to be doing some things to try to avoid you needing that. And there's a couple of things that require scripts. One of those is Seretide, which is classically used as an asthma spray. And it's a puffer, and we can write you a script for that. And we want to use that freely because it will relieve your cough and it will help you breathe better and help your oxygen saturation. The second script that we'll give to many patients is an antibiotic. And if you're coughing, we really are quite happy to prescribe that, because if we get it in early, we can stop the complication of a pneumonia. There's a few basic things that you need to do to look after your health. Ventilation or an air purifier is really important. And to stop these blood clots, please try, I know it's how hard it can be, to get out of bed and just do some walking. But we don't want anyone connected with active COVID entering the building. So for an oxygen saturation meter, what we want you to do is to park in the driveway out the front of the clinic, and our staff will come out and literally throw it through your passenger window. We don't want anyone coming into the building if there's any chance of contaminating our building with COVID. Now, we also provide a couple of other services in the car park. We have the antigen tests. So if you need a rapid antigen test to confirm the diagnosis, we can do it in our car park at 1291 Melbourne Road. Also, if you have family and friends that are contacts, we can also do the rapid tests on them. We also have the PCR tests. And it's important to know that after you've been through this infection, you may well want an exemption. Now, to do that exemption, we do want you to document while you're sick a positive PCR test, because that is one of the rules that we want to have in your file, stored the information that you've got a positive PCR. I am not currently routinely prescribing Fluvoxamine. This is an antidepressant, and some of the overseas studies are showing really good results with Fluvoxamine. I'm happy to discuss it with you, and if people are looking like they're really high risk for a serious COVID infection, then I'm happy to discuss Fluvoxamine. But it's not a routine thing, because I don't think we have enough experience in Australia yet of the use of Fluvoxamine, but it certainly has some promising studies overseas supporting its use. I hope you get through this. Give us a call if there's anything else that we can do to support you.